My main goal for caring for my patients is to make sure that I get them through their pregnancy safely. I'm Jerrie Refuerzo, and I am the director of the maternal care program here at the Fetal Center. So maternal-fetal medicine is a subspecialty of obstetrics and gynecology. And I really liked maternal-fetal medicine because it deals with high-risk pregnancies and complicated pregnancies. And in these particular cases, in pregnancy itself, there's two patients, the mom and the fetus. And I liked this focus of medicine because I could deal with the moms and her medical complications, but also the fetus if they developed any anomalies or had complications themselves. Here at UTHealth Houston, we have the Fetal Center. And one of the things that we did here is develop the maternal care program. So we're able to take care of moms with these high-risk pregnancies where their babies have either fetal surgery or newborn surgery. And we help them through that time period when their babies are in the NICU, which can be one of the most stressful periods in a woman's life. So here in the Fetal Center, we work as a team. My role here is to coordinate the deliveries for the patients. The fetal specialists will inform me of updates that are going on with the fetus. And if I need to, I will then plan their deliveries such that the pediatric specialists can take care of those babies right afterwards. So essentially, I'm the bridge between the fetal life and the newborn life. So Kenna was a special case. She came to me when her pregnancy was diagnosed with a fetal gastroschisis, and I followed her carefully through that pregnancy.
When we first learned that our first son Eli had gastroschisis and we had to, move my care and our baby's care over here, we didn't get to choose who they referred us to come here. And so at first it was kind of uneasy, but from the get-go, just meeting her and her team just made us feel so safe and secure.
And we decided to deliver her early, prematurely. And after her baby was born, unfortunately, her son passed and did not survive the newborn period. She and her husband, of course, were devastated by that. And so we helped her through the postpartum period, through that grieving process. And eventually, when she was ready, she became pregnant again. And although that might seem like a very positive and joyful experience, it was actually a very stressful time in her life, because with that second pregnancy, she was concerned that what happened to her first pregnancy could happen again.
Found out we were expecting again. Obviously we wanted to be cared for here. And then when our circumstances changed and our son now, Pierce, needed, more, just a higher level of care still. I'm glad we were already here. And she wasn't just caring for me. You could tell she knew she was caring for our family and for our future.
We watched her very carefully. We did lots of ultrasounds. We supported her. Whenever she was worried, we would bring her in and try to show her anything we could to reassure her that everything was fine. Our goal was to try to make sure that this baby was delivered safely. So not only did we watch her carefully outpatient, I actually admitted her to the hospital a few weeks before her delivery and cared for her and supported her. And eventually we delivered her prematurely before we saw changes within the bowels. And her son stayed in the NICU for about 6 to 8 weeks, and he did well. He had surgery after delivery. He fed, he grew, and she and her husband and her whole family was able to be with her son in the NICU, which of course is a very stressful time in their life. But she did really well, and I'm so happy that her and her family are doing well.
We were so excited when we got to take Pierce home. Mm-hmm. We didn't even go to our car, to our house. We came right over here
we had
to see her and introduce her and her team to Pierce. And I don't think we would be here without her.